So back pain is quite common. Up to 60% of the adult population will experience it at some point in their lifetime. There tends to be more muscle, bone and joint issues over the winter because of things like slip, trips and falls, and we do tend to see like an increase in the volume of calls coming through the 111 service during this time. There is a lot of different reasons why you get back pain. It can be coming from the soft tissues. There can be more underlying issues that might lead to back pain. The good news is, although it can be quite debilitating at times, there's a lot of things you can do to manage it, and usually it's not a serious problem and it's something you can manage quite well yourself. My top tips are keep moving. That's one of the most important things you can do. Even if that means a small amount of movement, it's better than none, but try your best to keep up with your normal level of activity and keep up your exercise activities as you can, and just modify if you need to. You can take pain relief to help it make it easier for you to keep moving, and it's a good idea to speak to your local pharmacist on the right painkillers for you. Anti-inflammatories, for instance, can be quite helpful in the initial stages of back pain to make it easier to get moving. Sciatica is a broad term that's used for back and leg pain. So there's a lot of different reasons why you can get sciatica. It can be related to the discs, for instance, or it could be related to some age-related changes. So lots of different causes of it, but you tend to get the same type of symptoms. Most of the time it's not due to a serious pathology, and there's a lot of self-management strategies that will help resolve this on its own. It's a good idea to have a look at the information on NHS Inform, and that will help give you advice on the things you can do to start and help with your recovery. And also it lets you know who to contact and when if you have a problem that's not resolving on its own. There's key moments when it's really important to get some help for your back pain. One of the most important things to be aware of is if you have any symptoms that affect your bladder or bowel, if you get a sudden change in your ability to pass urine, any lack of control, change in frequency or any retention, it's really important not to delay getting help for that. We would advise you to phone 111 straight away if you have anything like that, or if you have any change in sensation in between your legs, like your genital area, your back passage. It's very rare to get these symptoms, but it's just important that you know what to do if it does occur. We have a number of different resources available on NHS Inform that can help you. There's a key area on back problems that gives you lots of information and advice on what symptoms tend to happen, what to expect and how to best manage that. It also gives you lots of advice on who to contact and when if you have a problem that's not resolving on its own.